Hi, my name is Sonia Bates. Today I'm going to be talking to you about Hashimoto's thyroiditis. Hashimoto's is an autoimmune disease that was discovered by a Japanese physician named Hikaru Hashimoto. He discovered the lymphocytes in the thyroid that were inflamed. This is caused by the autoimmune disease attacking the body. And the symptoms for this type of disease in some people, not in all people, but in some people is weight gain, fatigue, hair loss, constipation. In women would be irregular menstrual cycles, slow heart rate, and sometimes a fast heart rate. Because with Hashimoto's in the beginning, you can have a hyperthyroid, and then later you can have, as it develops and the disease worsens, it becomes hypothyroid. So then you have a slower heart rate. An inability to get warm because your hormones are not functioning properly, joint pain, anxiety, depression, and also sometimes the difficulty swallowing. With Hashimoto's, often it's found because this person, male or female, most common in women though, have what's called a goiter. And in this goiter, you may have also nodules, little nodules that are mimicking a little thyroids. And so in this situation, you might need to find a physician that's an endocrinologist. And an endocrinologist is going to specialize in the thyroid. Now, the thyroid is in your throat, right where your Adam's apple is. And in my situation, as you can see, I have a scar. Back in 2000, after my son was born, I became extremely ill. And I had had a thyroid disease when I was about 17 years old. But after each pregnancy, I didn't need medication, and so I seemed fine. But after the very last one, when I turned 30, which is not uncommon for Hashimoto's to show up after a pregnancy, I developed severe depression, anxiety, fatigue, and not just because I had a baby, but because my thyroid wasn't functioning properly. So they tested my TSH levels, and often they were borderline. So it was misdiagnosed for a long time. They do have a special blood test that can test for Hashimoto's. So if you're finding that you have some of these symptoms, you can ask your endocrinologist to test you for these things. So with Hashimoto's, also, it affects your hormones. 7 times more than men, women are affected, and the sex hormones also play a role. Women have been known to develop Hashimoto's after having a baby, like I suggested earlier, within the first year of their delivery. This was actually happening for me over a period of time. I had 3 children in 5 years. So you can imagine my hormones were really off, as most of ours are, and it got worse with my thyroid disease, and my thyroid decided that it started to die. Hereditary is often a role as well. I do have family members that have thyroid diseases, and so it's not totally surprising that I came down with Hashimoto's. My father has developed a thyroid disease as well that we never knew about, but it's not Hashimoto's. Excessive iodine exposure for some, and then in different countries, radiation exposure. Increased cases have been reported in people exposure to like Chernobyl. How it's diagnosed: a thyroid stimulating hormone test called a TSH level will be given. Hypothyroidism results will be diminished levels of thyroid hormone known as T3 and T4. How you can treat it: conventional treatments would suggest that you use a synthetic thyroid hormone called levothyroxine, and that is something that I take every day, and I will take every day for the rest of my life. Sometimes you'll need surgery. In my case, I needed surgery, and this was because with the goiter that I have, some of the little nodules were encroaching into my windpipe, and so it was difficult to swallow. And at this time, they also thought I potentially had thyroid cancer. which I do not, that results in a biopsy. Many biopsies actually over time, even after being diagnosed with Hashimoto's. And I chose to have half of my thyroid removed. And the reason for this is because I really wanted to work with my personal thyroid as much as I could, so that I was getting as much life out of my regular thyroid as possible. And it's worked so far. Eventually my thyroid will die. And because of the Synthroid that we have now, I can take that every day as long as I don't miss my diagnosis or miss my pills. Now, when a person may miss their medication, they may have symptoms such as dizziness, fogginess, lack of memory, balance, fatigue. My children always called it my crazy pill. If I didn't take my pills, I was really off. And so it's definitely important when you get on a regimen to take your medication. And the doctors will titrate that for you. In the beginning, you will have a blood test and they will make sure what levels you're taking. And then you'll go back in about 3 months later and you'll take another test and you'll change your medication to what is most sufficient for your thyroid, what works for your body. So the thyroid function TSH levels prior to your thyroid treatment, some people are at like a 9.8, 4 months after 2.16, and then 12 months after is a 4.15. One of the things that I found with this thyroid disease is definitely a diet. For me, and the research that I have done is that it's really important to have food that doesn't inflame your thyroid. And if you take cruciferous plants such as broccoli and kale and Brussels sprouts that are not cooked, they will cause inflammation. White potatoes will cause inflammation. One of the things I also discovered is gluten is a huge poison to thyroid. Now, this doesn't mean that I have a disease or an allergy to gluten. Even my doctor decided that it was really best for me to go off of it. And since I have, my health has been tremendous. Some of the things with the thyroid disease that people notice with Hashimoto's is that they gain weight. And in my case, it's opposite. It really depends on your body and your hormones. For me, I will lose weight if I'm not on the right diet, on the right medication, proper sleep, no stress, which is really hard when you're in school. I get really sick and I will lose weight. So those are really good things for a patient advocate and a navigation person to help with someone who might develop something such as depression. In the beginning of my disease, I had depression. Nobody knew what was wrong. And because my thyroid was out of balance, and even after my medication started, I was still not quite right with my hormones. And a lot of depression set in. I didn't know how to treat myself. I didn't know what I could eat, what I couldn't eat, how much sleep. All of that is so stressful. So patient navigator, it's really important. I think one of the things we learned in class, and I've applied to my life as well, is mindfulness. Mindfulness of what your body can handle, the amount of stress you can handle, and how you fix that in your life. What does that look like for you, and how do you work through that? Is it yoga? Is it walking? Walking for me, is it going to the gym and exercising? Exercise is super important for a thyroid disease, especially Hashimoto's, because you can get the joint stiffness and you can get so fatigued. But if you keep on a schedule, such as sleep and lots of water, then your body can get used to the medication and just you function a lot better. The other thing that a patient navigator could really help with someone with Hashimoto's is when they develop anxiety. A lot of people believe that anxiety is just in your head. Well, when you have a thyroid disease, Hashimoto's can cause anxiety. It's also a lack of sleep and stress. But if your medication is off and you're not even paying attention to that, an advocate can help you deal with the anxiety. Make sure you're taking the proper medication on time, and even help you with someone that can counsel you into a health regime that's best for you, that deals with those kind of things. I also found that in this situation, there's an American Thyroid Association, ATA, and www.thyroid.org. So all of these things are really helpful for Hashimoto's, and I hope that you guys find this video interesting. Bye.